Do you suffer from swollen feet? If you have diabetes, then you know how uncomfortable and frustrating it can be. Well, I have some tips that can help. One of the most common complications of diabetes is swollen feet. But don't worry, I'm going to share with you 10 tips that can help treat your swollen feet and make them more comfortable. Diabetes can make your blood circulation bad. This can cause fluid to build up in your feet, ankles, and legs. When this happens, the area swells up. Edema is when there is too much fluid in the tissues of the feet and ankles. You might have swelling in one specific place, or it could be more general. Swelling can happen after eating salty foods, sitting in one position for too long, or due to hormonal changes. These are not the only causes of swelling, though. Diabetes and swelling. Diabetes is a condition where the body doesn't produce enough insulin. Insulin is a hormone that the pancreas releases. It helps your cells absorb sugar. If your body doesn't use insulin properly, high levels of glucose, sugar, can build up in your blood. If this happens without treatment, the high levels of glucose can damage the lining of smaller blood vessels. This damage can result in poor blood circulation. This poor circulation can cause fluid to build up in the feet and ankles, which can lead to swelling. Other causes of swelling. If you have high blood sugar over a long period, it can damage the nerves in your body. This can lead to a loss of feeling, which makes it difficult to detect injuries like sprains, fractures, and cuts. If you don't treat your sprains and fractures, they might swell. If you don't treat your cuts and scrapes, they might get an infection. If you have diabetes, it's important to check your feet regularly for any cuts, bruises, or other injuries. See a foot specialist occasionally to check for any problems with your circulation or nerves in your lower extremities. The National Health Service says that other factors that may cause swelling in the feet include diabetes, related conditions such as obesity, venous insufficiency, heart conditions, kidney concerns, medication side effects. In rare cases, edema may result from a tendency for the blood vessels to leak fluid. This can sometimes happen when you take a lot of insulin. If you are experiencing swelling from diabetes, here are 10 tips to help manage fluid in your feet. Use compression socks. Compression socks help to keep the right amount of pressure on your feet and legs. This can improve blood circulation in your feet and reduce swelling. Compression socks go up to your calf. Wear them as regular socks during the day and remove them before going to bed. Determine if you need to use one or both legs. Compression socks should not be too tight. You should start with light compression and increase the compression if necessary. If a sock is too tight, it can reduce blood circulation. It is also important not to put socks over open wounds or sores. Elevate your feet. Elevating your foot above heart level can also help reduce fluid retention in the lower part of your body. This is done by returning fluid to your body instead of it collecting in your foot. You can elevate your foot while sitting on a couch or lying in bed. If you're sitting at a desk and can't keep your legs above heart level, using an ottoman or small stool may provide some relief from swelling. The legs up the wall yoga pose may help you feel better. To do it, lie down on your back and put your butt close to the wall. Raise your legs and rest them against the wall. Hold this position for 5 to 10 minutes. Exercise regularly. Exercise is not only helpful for weight management and improving blood sugar, it can also promote blood circulation and reduce swelling that results from inactivity, according to the NHS. To start, you may find it beneficial to choose non-weight-bearing exercises, like swimming, cycling, and walking. According to a 2018 research review, studies show that a combination of aerobic and resistance exercise is the most effective way to manage blood glucose levels. Manage your weight. According to the American Diabetes Association, maintaining a healthy weight and avoiding excessive calorie consumption can help you manage your diabetes. Adopting a healthy lifestyle, including maintaining a normal weight, can help people live longer and healthier lives. Other advantages of maintaining a healthy weight include reduced joint pain, less cardiac disease risk, and more energy. Stay hydrated. Drinking more water may appear counterproductive if your body retains fluid. However, the more fluid you intake, the more liquid you'll be able to expel through urination. Furthermore, when you are dehydrated, your body retains additional water. Before increasing your fluid intake, consult your doctor to see if it is appropriate for you. If edema is caused by heart or liver disease, your physician may advise you to restrict your fluid intake at times. Limit salt. Excess salt intake can also cause edema to worsen. The dietary guidelines for Americans recommend a sodium intake of no more than 2,300 milligrams per day. Trusted source. If you have diabetes, you may need to restrict salt consumption. To determine how much salt you can safely consume on a daily basis, speak with your doctor. I'm going to reduce it by half. Eat more fresh fruits and vegetables. Avoid purchasing and eating processed foods. Look for low-sodium canned goods when choosing canned goods. Instead of salt, it can be helpful to cook with herbs such as garlic powder, oregano, rosemary, thyme, paprika. Get up and move every hour. Sitting for long periods of time can also cause swelling. To improve blood flow, get up at least once every hour and go for a quick 3 to 5 minute walk. Try magnesium supplements. Magnesium is a mineral that aids in the maintenance of proper nerve function and blood sugar levels. Fluid retention or edema can be an indication of a magnesium deficit. According to the National Institutes of Health, men require 400 to 420 milligrams of magnesium daily, while women require 310 to 360 milligrams. A person's magnesium needs increase throughout pregnancy and breastfeeding. If you have chronic kidney disease, magnesium supplements might cause an accumulation of magnesium in your blood, resulting in muscular weakness. Experiment with essential oils. Some people think that applying certain essential oils to the skin can improve blood flow and reduce edema. According to a 2017 review, oil from Hyptis marciaceae benth improves edema in rats. Oil from Hyptis marciaceae benth has been studied in 2013. Also found that lavender oil may improve blood glucose management and protect against oxidative stress in people with diabetes. When applying lavender essential oil directly to the skin, you should always do a patch test and use a carrier oil. Soak your feet in Epsom salt. Epsom salt is a magnesium sulfate compound that aids in the relief of pain and swelling. You can fill a foot bath or tub with water and Epsom salt to make a relaxing foot bath. If you have diabetic neuropathy, test the water temperature with your hands first to avoid injuring your feet. When to reach out to a doctor. If you have new swelling, worsening swelling, or swelling all over your body, contact your doctor. They can diagnose the condition and may give you home remedies that are right for you. Swelling in a person with diabetes may be caused by a problem related to diabetes, such as obesity, venous insufficiency, and heart failure. Make a point of examining your feet on a regular basis to avoid infections. If you have any sores, ulcers, or blisters that won't mend, see a doctor right away. Key takeaways. Feet swelling can occur whether you have diabetes. Many reasons lead to leg swelling in individuals who have diabetes. Exercising, elevating your feet, and staying hydrated may help with some cases of edema. Even if these home treatments help, it's vital to discuss any new or persistent edema with your doctor. Thanks for watching, share your thoughts and subscribe for more.